With that, I would like to transition to Melissa Melon, and she will be telling us why, okay, why when you need to transform your food system, it's important to address the commercial determinant of health. So I would like to invite Melissa, Dr. Melissa Melon, to take the floor.
Thank you, Silver, and thanks for having me for this presentation. I'll try to share my screen. Yeah, okay, thank you very much. Okay, so yeah, I'm Melissa Mialon. I'm a research assistant professor at Trinity Business School, Trinity College Dublin in Ireland. I'm a French and Mauritian national and actually based in France. I work part-time at Trinity, and I have no conflict of interest to declare, which is important for the discussion that we will have. The title of my presentation is Transforming Food Systems Requires Addressing the Commercial Determinants of Health. So first, to start with, an introduction on what are the commercial determinants of health for those of you who are not familiar with this concept. So we had the Lancet series on the topic with 3 publications that was published earlier this year. If you're interested, because I won't cover everything, and it's not just about the food industry, it's about commercial actors more broadly, and I'll illustrate that. But if you're interested, you can read the series, and we also have an editorial with it and commentaries also that comes with the series. So we define in our series the commercial determinants of health as the systems, the practices and pathways through which commercial actors drive health and equity. So in the definition, also in the literature, there was a lot of focus on the negative impacts of corporations on our health and planetary health plus equity. We've remained neutral with the definition because both aspects could be covered in research, both the positive aspect and negative aspects. With my research, I'll cover mostly the negative aspects of commercial practices and the presentation here. So just a very brief introduction to what we mean when we discuss the commercial determinants of health beyond this definition. So we know that, here in the middle, in that big half circle, in the middle in yellow, the outcome is that people are getting sick and we have increasing inequities. And why is that? Is because we use and consume, we have access, we are exposed to certain practice, to certain products, and certain practices. For the food system, it's mostly around ultra-processed foods, plus other foods with too much sugar, salts, etc. We know that beyond individual behavior, people have access, people use these commodities because we live in certain environments, including physical environment. Socioeconomic aspects also are included in the model. And we know that those environments in turn are shaped by a number of policies, such as trade and investment agreements, policies on agriculture, policies on the environment, and other type of policies. With the commercial determinants of health, also, we are increasingly interested in the political and economic system that is shaping those policies that are in turn shaping our environments, etc. So we are taking a step back from the individual behaviors and personal responsibility, and actually showing with, we have a lot of research behind this model and our series, showing that the political economic system is responsible for the way that, people behave, and also for their ill health and also that of the planet. With our research, we focus here on commercial actors and the third parties that they work with. We know that corporations and commercial actors use different political practices, scientific practices, reputation management. Also, they have certain employment practices, marketing, and we are covering all of that when we discuss the commercial determinants of health. Because of those practices, commercial actors are able, of course, to shape the system in which we live, but the system is also enabling and empowering corporations to behave the way that they are behaving. What we say also in our Lancet series is that there are underlying drivers for the way that corporations are behaving. So we have certain norms that are shaped in the interest of a commercial elite. Corporations don't pay for the impacts that they have on our health, so they have externalities. And because they don't pay for that, then they are able to grow and get more wealth and get more power, make more profits, while states who have to pay for our healthcare systems when healthcare systems is in place, or when it's individuals, then there is a decline in power from the state and society. And the more corporations, grow in power, the more they can in turn, shape norms in this circle. So for my presentation, the rest of my presentation, I'll focus on a very specific aspect of the commercial determinants of health, which is what we call the corporate political activity of the food industry. So the way that food companies and their allies are shaping public policy, and it could be directly going to lobby our governments or make donations to political parties, and other ways of influencing policymakers, but it's also indirectly by influencing the science that is then used in policymaking, also shaping public opinion in favor of the industry. And I've just illustrated here that we have several dozens of publications on the topic for different countries. And at the country level, we have mapped those practices. So here's just an example of manufacturing public support by the industry. I just searched quickly on the internet for an example in our continent in Africa, and this one is in French. Sorry, it's from Mauritius. And during the COVID-19 pandemic, Coca-Cola made a donation of an ambulance to the Red Cross in the country. It has to be seen as it's a marketing, we can call it also stakeholder marketing. So they are indirectly making some marketing and influencing, of course, people in the healthcare sector who received a gift. How can you then criticize Coca-Cola? But also the broader public. So that was covered in the media, for example, that example of a donation. So it's very strategic for food companies to do that. And I have to tell you that I'm a food engineer, so I was trained to develop those kind of practices. Not only that, I also work in food science and I did a master's in food science and engineering. So this is very common practices of corporations to try and influence their audience. There is also, within this, indirect political influence, there is the manufacturing of support, but also of evidence, and the manufacturing of doubt. So we know, and we have ample evidence for that from all continents, from the international scientific literature in nutrition, for example, that corporations are also trying to be accepted as normal public health experts in nutrition, while we know that the product that they make could be unhealthy. Plus, also on the one side, they want to be our partners, but on the other, we know that behind closed doors, they are lobbying our governments so that governments don't adopt public health policies to protect their population. So there is also that incoherence between what those companies are doing. So I just found, again, two examples quite quickly and easily. The associations for the dietetics in South Africa, their sponsors include, for example, Unilever and Pick and Pay. The Africa Food Systems Forum included amongst his supporters Bayer, which is the former Monsanto. And so for the industry, it makes them as if they were like normal public health players. In Latin America, we had done a study of over 2 years, all of the nutrition and dietetics events, and we found that there were 92 food industry actors who sponsored 88% of those events. There was even an event by Nestle which was all set up and funded by Nestle, so entirely supported by the food industry. So we have a real capture of nutrition and of our events, be it in Africa, in Latin America, in other continents. There is a conference happening this month in Europe, and it's the same. So what is the problem with this conference is that those actors, they will focus on individual responsibility, physical inactivity. They won't talk about ultra processed foods, except to tell you that it's not a relevant way of thinking about our food system. So they are really shaping our way of understanding food systems. Manufacturing support and manufacturing doubt is not, if we come back to the commercial determinants of health, it's not something that is unique to the food industry. So for example, here it's big oil, ExxonMobil. We know from their internal documents that way, back in the 1970s, they hired scientists, and the scientists made projections on what global warming will look like. And they knew, what will happen. They made the exact, right projections. So it's what is happening now is what they had projected. The worrying thing is that, because they knew that, then they have lobbied the US government and other governments so that fossil fuel would not be regulated. So we are paying the price for this, even if the industry knew it was their project would have an impact on our health and that of the planet. Here you have the alcohol industry who goes to school and fund education programs. So when they go to schools, it's one way for them to talk about alcohol. It's a door of entry for the industry. The tobacco industry wrote that in the internal document. We will talk about tobacco control in schools. And for us, it's a great opportunity because otherwise we wouldn't be able to go to schools. And in those programs, they will talk about personal responsibility, about people who drink too much, and that's the problem. While we know that for the first drop, alcohol is carcinogenic. So they will just present you with biased information and at the same time trying to market their product as well. And then here, another example is the opioid epidemic and crisis. We know that the opioid industry conflated and talked with doctors about their product as if they were very, very successful at treating pain, etc., and could be given to a lot of patients, and that has led to a lot of harm in the American population and in other countries. And they paid doctors to say that. So the risks, I've started discussing that, but the risks with this influence from corporations, if we just think about one of the practices, like the corporate political activity, and I'm not talking about marketing, and I'm not talking about the way that they treat their employees, etc. So just, the political activity, their influence, we have evidence that they are presenting people with biased information. They also propose market-based solutions. So always a product, reformulation, for example, is one illustration of that. That food should be different, and instead of having minimally processed foods, then they will propose another version of their ultra-processed foods. And in 15 years, we will understand that it was not the good solution. They focus on individuals, as I've said. Also, our government and the public sector are disengaging from research and communities if the industry is here to pay for those things. So it's also a problem in that sense. The industry gets credibility by association and has access to new networks. And at the individual level for professionals, for example, in those conferences, there is a perception that you are biased. If the public look at our congresses, for example, in pediatrics, and they see the infant formula being in there, they will think like, well, those pediatricians are biased towards infant formula and not necessarily protecting breastfeeding, even if that's not necessarily the case, but there is that perception and that risk at least. There is also lack of independent judgment. It has been shown for the pharmaceutical industry, for example, and medical doctors. And people are also little inclined to then criticize and question the food industry. With our Lancet series, what we said for the future directions is that we need to shape the system for the public interest instead of for corporations and commercial actors. The externalities need to be paid for by commercial entities and meet their true costs. The power need to be, back to governments, civil society organizations, and certainly more balanced with that of commercial actors. Very quickly, again, you can look back at look and see more information in our Lancet series. That's from the third publication, but we are saying that we need collectively, and not just in health, in the health sector, but education, financing, etc. We need to prioritize public interest over commercial profits. So we want states and international organizations ideally to change policy system, for more equity and sustainability. Civil society organizations to raise collectively their voices. So collective action is very, very important. Commercial actors just to stop their opposition to public health regulation when we know it's important to be introduced and comply also with what is existing. Researchers, we should provide more evidence of those commercial determinants of health. For example, there is limited research in Africa on the topic, and health factors can also break the hegemony of a biomedical approach to health and engage more broadly also with other sectors than health. If I just focus quickly on addressing the corporate political influence of the food and other industries, we need more transparency. And that's from a literature review that we've done. Transparency is important. So between the industry and a public health professional or organization, we need to know what type of interactions they have, what are the conflicts of interest that professionals have. We need to identify, monitor, and educate people also about the corporate political activity, but also the commercial determinants of health more broadly. We could manage those interactions and in certain cases prohibit the interactions. So for example, you have several medical journals who don't accept publications from the tobacco industry, or where there is a researcher who worked with the tobacco industry. It's increasingly the case also for the infant formula industry and journals in working on breastfeeding and maternal and child health. And so in terms of, for example, educating about the corporate political activity, it was mentioned in the previous sessions. We've done a workshop to build capacity among the Healthier Diet for Healthier Lives project participants. And it was a half-a-day workshop, and we discussed, what I've just discussed here, presenting people with evidence, and there was a platform also to discuss the experience of our colleagues in Ghana. A word also on coloniality, commercial determinants of health and healthy diets, because it's so important to me in that discussion in Africa. So we know that, for example, the sugar industry has a legacy, is a legacy from the Dutch and British trading companies and other trading companies. So we discuss and we see some discussions of that industry and how what we observe today is also a product of that history. But it's important to understand that coloniality still permits research, advocacy, and public policy on healthy diets. It continues to be dominated by powerful commercial actors. Ultra-processed products, for example, are aggressively marketed to children, women, Black, Indigenous, and people of color, amongst other groups. And commercial actors, as it was mentioned before, I think it was yesterday, they penetrate low and middle income countries because their markets are saturated in high income countries. International fora are also dominated by powerful commercial actors from countries like the US or from the European Union. That was the case with the UN Food System Summit. And then you have countries also where global large corporations are headquartered, such as the US and again, European nations that serve as a proxies for that corporate influence. So at the UN level, for example, when there was a discussion on breastfeeding, Ecuador wanted to support a discussion on breastfeeding, and at the WHO level, and the US made threats to Ecuador to restrict some of its trade with the country and other important points for Ecuador. So Ecuador just didn't support in the end the breastfeeding discussion. We need also more space for critical thinking in dietetics and health training on the legacies of coloniality, including imperialism, patriarchy, capitalism, elitism, and privatization. And we also need to discuss the role of international versus local researchers in our global nutrition research that is conducted in low-income countries. I don't know if any of you know the term helicopter research. So that's when people from high-income countries do their research and then go back to their institutions with little or limited implication from people in the field, local researchers, both in the writing of the work and also the dissemination. We also need to amplify local knowledge and local authorship in research, and we need national health strategies that explicitly include the protection of public policy from commercial vested interest and rather give a central space to marginalized voices. Thank you.
Thank you so much. Yeah, thank you. I see you have some claps and good comments in the chat box. Thank you so much. So fantastic. That's how complicated. It's not an easy battle, I would say. Yeah, a lot of people are. Yes, I see hands up. Okay,
it is, yeah,
so
it
let's
is,
take
Silver. Yeah, can I just perhaps mention that we had those discussion yesterday, and it was very interesting because in almost all of the countries, the case studies that were discussed, there was that mention of the industry interference, and we have actually evidence for that. Every time in public policy, at least, we try to implement or adopt something, the industry is pushing back, just to delay things or trying to avoid the adoption of those policies. So we have every evidence for that on other aspects like corporate social responsibility, helping communities, etc., that they put a different face and a different framing, of course, but those contradictions have to be explained to the public.
Yeah, definitely. And I think this is a wonderful eye-opening presentation. I've seen hands up and very good comments in the chat box, definitely. So please, if you have a question, the floor is open.